Hello, everyone. This is our project of assessing the readiness to treat critically ill pediatric patients in a general emergency department. Our project evaluated pediatric readiness across a general emergency department system by looking at clinician exposure to critically ill pediatric patients, procedural confidence, and confidence locating pediatric resuscitation equipment. So, general emergency departments care for children on a very regular basis, but truly critical pediatric emergencies are relatively uncommon. Because of this limited exposure, clinicians may feel less familiar with pediatric workflows, size specific equipment, and the resuscitation process. National studies have shown that pediatric readiness varies widely, especially in community settings, and that higher readiness is associated with better outcomes. Our aim was to assess pediatric readiness across one 45-bed community hospital ED, along with two affiliated freestanding EDs. So we conducted a cross-sectional survey of physicians, ED technicians, and respiratory therapists. A total of 207 clinicians were invited to participate, and we received responses from 118, giving us a 57% response rate. The survey assessed exposure to critically ill pediatric patients, participation in simulation training, procedural confidence, and confidence in locating pediatric equipment. We did focus on four key equipment categories, those being airway supplies, general pediatric equipment, central line supplies, and chest tube supplies. Our results showed that most clinicians encounter critically ill pediatric patients only every few months, confirming limited exposure. Procedural confidence was moderate overall, with respiratory therapists reporting the highest confidence, physicians reporting a moderate confidence, and nurses reporting somewhat lower confidence. One of the most important findings was the confidence in locating pediatric equipment. Physicians reported the lowest confidence in this area, which was notable because it suggests that pediatric readiness barriers may be more related to systems and workflow rather than clinical skill alone. In terms of equipment accessibility, airway supplies were the most frequently reported missing category, while central line and chest tube supplies were often the hardest to locate. Clinicians also reported inconsistent equipment organization across the different ED sites. These findings have significant patient safety implications. In pediatric emergencies, especially those involving airway compromise, delays in finding appropriately sized airway equipment can delay intervention, increase cognitive burden during resuscitation, and potentially worsen outcomes. Overall, our study suggests that clinicians generally feel moderately capable of performing pediatric procedures, but systems level gaps, particularly in the area of equipment accessibility and organization, represent major barriers to pediatric readiness. Based on these results, we did identify several high impact opportunities for improvement. First, implementing standardized pediatric resuscitation carts across all sites could improve consistency. Second, Broslow-based or weight-based organization could streamline rapid equipment retrieval. Third, multidisciplinary pediatric simulation training could reinforce both technical skill and team coordination. And finally, improving communication and role clarity during pediatric resuscitation and emergent situations can further reduce delays. In conclusion, pediatric readiness challenges in our ED appear to be primarily systems-based rather than skills-based. Improving equipment standardization and accessibility may be one of the highest impact strategies to reduce delays, improve workflow, and enhance pediatric patient safety. Thank you for listening to our presentation, and we will be happy to answer any questions you may have.